Hello and welcome to today's presentation. Today we shall be looking at family planning, which is abbreviated as FP. This is contraceptive technology. Most of the questions emanating from these sections will be in paper 1 of the NCK examination, but you could find some in the paper 2 sections, right? So let's get right into it. We start by defining what FP or family planning is, and this is the practice of controlling the number and the spacing of children within a family setting. And this can be done through the use of contraceptive methods and other reproductive health services that we are going to discuss in our presentation today. It encompasses a variety of strategies that allows individuals or couples to anticipate and attain their desired number of children, as well as to determine the timing of the births. So family planning methods could be like birth control pills, the use of contrast or condoms, in intrauterine devices, sterilization procedure, and even natural family planning methods. Generally, in family planning, as an RN, you'll be involved in facilitating patient education, counseling, more so on reproductive health issues, fertility awareness, prevention, and treatment of infertility. So, generally, we can say that family planning is an essential component of public health and is closely linked to the woman's health, the child health, and the overall family well being. Of course, family planning offers numerous advantages to individuals have practicing them, also their families, and their society as whole. Number one, we have like family planning helps improves maternal health. So you find family planning reduces the risk of maternal mortality by allowing women to avoid unintended pregnancies and space their pregnancies, which is crucial for their recovery and health. So, in doing so, family planning helps prevent high risk pregnancies, particularly in very young or old population or with those who have pre existing conditions. Family planning also reduces infant mortality by ensuring pregnancies occur at healthier times in a woman's life. So, in doing so, family planning helps improve the health of children by allowing parents to adequately care for and support each child. Family planning enables families to plan and allocate resources more effectively, leading to better economic stability. So this will help allow women pursue education, career opportunities, which later contributes to family income and also economic growth. Family planning empowers women by giving them control over their reproductive health, and this leads to greater participation in education and workforce. This also helps promote gender equality by reducing the burden of unintended pregnancies and childbearing on women. Family planning also helps control population growth, which can elevate pressure on natural resources, infrastructure, and public resources. So, this will help contribute to sustainable development by managing population size and also growth rates. Some family planning methods, like the female and male condoms, they normally help prevent the spread of sexually transmitted infections and including HIV/AIDS. Generally, the practice of family planning method helps improve the overall quality of life by allowing families to have the number of children they desire and can adequately care for. So, in doing so, family planning supports family stability by reducing the stress associated with unintended and unplanned pregnancies. By controlling population growth, family planning can reduce environmental degradation and also contribute to more sustainable use of resources. Even as we champion for family planning methods, they also come with some of the disadvantages. And the demerits could include We have some family planning methods such as the hormonal of birth control pills, the injections, and the intrauterine devices. They have the potential of causing side effects like weight gain, mood changes, irregular bleeding, and headache. While certain methods like sterilization are normally permanent and therefore they require careful consideration before use, failure to do it might result into regrets, right? And which may be so depressive to the client. In some regions, you find that access to family planning methods and contraceptives may be limited, and this could be due to economic factors, cultural factors, or even logistical barriers. So, you find that rural and low-income population may face challenges in accessing these reliable FP methods and resources. Cultural and religious beliefs may also oppose the use of contraceptives, and this normally leads to resistance and stigma associated with family planning. Family planning may conflict with the traditional values regarding childbearing and family sizes in most indigenous communities. Family planning methods also, especially the long term or the permanent options, as we have indicated, can be expensive and may not be affordable for everyone. In addition, we also have this insurance cover or funding. This is not, it's limited, and it cannot be able to cover for these methods, and this could create financial burdens and barriers to different families. We also have misuse or incorrect use of methods. So, incorrect use of contraceptives, such as missing birth pills or improper use of condom use, can lead to unintended pregnancies, and this defeats the meaning on the use of such methods. So, lack of proper education on how to use contraceptive can reduce their effectiveness. Some individuals also may experience guilt, anxiety, and moral dilemmas related in the use of contraception, particularly if it conflicts with personal or religious beliefs. And in cases of permanent methods, like we had indicated, individuals could later regret their decision. Certain methods may carry health risks, particularly for individuals with pre-existing condition. Take, for example, hormonal contraceptives. You find that they may increase the risk of blood clot in some women. In rare cases, IUCDs can also lead to complications like infection or intrauterine perforation. Some methods like condoms or family planning may require cooperation and agreement between partners, which may not always be present. So disagreements about FP can also lead to conflict within relationship, and unfortunately, it can be a cause of gender-based violence. Lack of comprehensive education on family planning methods can lead to misconception and fear about contraceptive methods, and this reduces their adoption. So, misinformation can prevent individuals from making informed decisions about their reproductive health. Now, so in looking at the family planning methods, we have to look at another key concept in women, and that is the menstrual cycle, which just includes the series of hormonal changes that normally prepare the female body for the pregnancy each year. So it typically lasts about 28 days, but can vary between 21 to 35 days in an adult. And this cycle is divided into several phases, and there are four phases, of course. We have the menstrual phase, the follicular phase, ovulation, and the luteal phase. Maybe starting with the menstrual phase. This phase marks the beginning of the cycle. That is the starting, and it starts with the menstrual bleeding. And this phase can last about 3 to 7 days. The shedding of the endometrial lining normally occurs when the previous cycle didn't result in pregnancy. And this could lead to discharge of blood, mucus, tissue from the uterus through the birth canal. Bleeding is usually heaviest on the first 2 days, but once the bleeding stops, the uterine lining or the endometrium will begin to prepare for the possibility of a pregnancy. This phase, the menstrual phase, is characterized by low levels of estrogen and progesterone. And low levels of estrogen and progesterone normally signal the pituitary gland to start the cycle again. That takes us to the second phase, which is the follicular phase. So this phase, of course, overlaps with the menstrual phase initially, so we can say it also starts with the on the day one, right? And this phase is characterized by the development of the follicles in the ovaries. So, you know, in the menstrual phase, we had the low levels of estrogen and progesterone. This stimulated our pituitary gland to start the process again, and the pituitary gland responds by releasing the FSH, the follicle stimulating hormone. This will stimulate the growth of about 10 to 20 follicles, each containing an immature egg. So one follicle will become dominant and will continue to mature, while others will disintegrate. Estrogen levels will begin to rise. When there is estrogen, it's going to promote the thickening of the endometrial lining to prepare for potential implantation. That takes us to ovulation as the third phase. And you find that around the middle of the cycle, there is an surge of LH hormone, the luteinizing hormone, which triggers the release of a mature egg from the dominant follicle in one of the ovaries. So this egg will travel through the fallopian tube towards the uterus, where fertilization can occur if the sperm is present. This phase is usually very short and typically lasts about 24 hours and marks the period of peak fertility. There are methods to track ovulation. Of course, we are going to be looking at them. But just to mention, we have the use of the calendar, checking of the mucus, the cervical mucus, and using ovulation predictor kit, right? Luteal phase, where after ovulation, the empty follicle will transform into a corpus luteum. This corpus luteum normally secretes hormones, majorly the progesterone. So this progesterone is going to maintain the thickened endometrial wall. Remember, the thickening of the endometrial wall was facilitated by which hormone? Estrogen. What is going to maintain it? Progesterone, right? And this will create a supportive environment in case of fertilization. Ladies and gentlemen, that's why progesterone is normally referred to as a hormone that maintains pregnancy, right? So if the if the egg is not fertilized, what happens to the corpus luteum? Does it continue secreting progesterone? No. The corpus luteum will disintegrate, and this will cause a drop in the progesterone and also estrogen levels. This hormonal drop will lead to the breakdown of the endometrial wall, initiating again the new menstrual phase. Okay, guys. So as you interact with the patient in family planning, you're going to be using a tool that will help you to counsel and interact with the patient, and that tool is what we refer to as the gather approach. If you are told to define it, it is simply a structured method used in family planning methods to ensure that the client receives comprehensive, personalized, and respectful guidance, right? So you start by greeting the clients. Well, so you welcome the client warmly, you make them feel comfortable, introduce yourself, and ensure a private, confidential setting. You have to ask the client how they are feeling today and if they have any specific concerns. So you end up establishing rapport and creating an judgmental atmosphere. Maybe an example in context could be, good morning, patient X. My name is Thomas and Aaron, and I'll be working with you today to discuss your family planning methods. How are you feeling today? and then they can be able to give their explanations and how and the introduction and how why they have come there and maybe what they need to do. From there, you then ask about their needs, right? So you have to understand the patient's FP needs and concerns and preferences. So you can ask open-ended questions just to explore the client's reproductive goals, sexual health, and any previous experiences with contraception. You inquire about their current knowledge of family planning methods, and then they discuss their lifestyle, health status, and any relevant cultural or religious consideration. You could say, to ensure that we find the best family planning option for you, could you tell me a bit about your goals and any preferences you might have? For example, do you have a specific time frame in mind for starting or expanding your family? Or are there certain methods you are more interested in? Once they have explained or described, you could tell them, thank you for sharing that. I also want to ensure that we consider any health or lifestyle factors that may affect your option, such as your current health, past experiences with FP, or any particular preferences or concerns that you have. All right? Okay. Then from there you can proceed to T, which you are telling them about the options that you have. You're providing clear and accurate informations about family planning methods, explaining the different contraceptive methods, including their effectiveness, benefits, side effects, and how they can be used. Remember, you can use visual aids, brochures, or model if they are available just to enhance your understanding. Then ensure that the information is tailored to the client's needs and the preferences. From there, you help them make a decision. Remember, you have to support the client in making an informed decision about the best method for them. So you keep on encouraging the client to ask questions, express any concerns and doubts that they have. Then discuss the pros and the cons of each method in the contents of a client situation. Respect the client's autonomy in making final decision and avoid pressuring them into a particular method. Okay, they are the ones to own the method. So you have to explain how to use the method by providing a detailed instructions on how to use the chosen method correctly and consistently. You could demonstrate on how to use the method if applicable, or you provide clear verbal and written instruction. So you discuss any follow-up appointments or necessary health checks associated with the method. Remember to emphasize on the importance of consistent use of or use just to ensure effectiveness, and discuss what to do if they encounter any problems or miss a dose in the case of the oral pills. You also need to arrange for follow-up care and ongoing support. So you have to help schedule a follow-up visit to monitor the client's satisfaction and address any issues or side effects they may experience. You have to provide information on how to reach out if they have questions or concerns before the next visit, and discuss what to do if they want to change their method or if they are planning pregnancy in future. Ladies and gentlemen, in doing so, you should also help the patient now arrive at the particular family planning method that is suitable for their situation. And in doing so, we normally use the WHOMEC, right? WHO medical eligibility criteria for contraceptive use. This tool is used to assess and determine the most suitable family planning method for a patient. So this tool provides evidence, right? It provides evidence-based guidelines on the safety of various contraceptive methods for individuals with different medical conditions and lifestyles. And to facilitate this, you have to collect detailed patient information, like you gather patient's medical history, current health status, reproductive goals, lifestyle preferences, and any specific concerns regarding the contraception. So we have the WHOMEC criteria, which has 4 categories of the FP methods. Remember, WHOMEC criteria provides safety guidelines for contraceptive use based on the medical conditions. So we have like category 1, where there is no restriction for use. This method is normally safe for all users. Category number 2, we have methods where their benefits generally outweigh their risks. So they are usually acceptable for use. While category number 3 is where we have methods whose risks may outweigh the benefits, so you have to use these methods with caution, or you could seek alternative methods. Category number 4 is where the risks are, we have unacceptable risks. So the method should not be used for that particular patient, right? Remember, when you're helping the patient choose a method, you have to choose the patient preferences and lifestyle. You have to always use counseling tools like the gather technique that we have said. And then lastly, you tailor the method based on the reproductive goals so that you align the choices with short-term and long-term FP goals to ensure that the selected method meets the patient reproductive plans. All right, guys. So we have a number of family methods that we need to be aware of, starting with the natural family planning methods. These methods involve no medical or hormonal interventions. So they rely on awareness of the woman's natural fertility cycle and behavioral practices. We have a number of them. We have fertility awareness based methods, withdrawal method, and lactational amenorrhea method. Maybe starting with the fertility awareness method. Of course, these methods involve tracking the menstrual cycle to determine the fertile days. And if you look at it, the typical effectiveness is about 76% when effectively used, right? And it involves methods like calendar method, basal body temperature, and the cervical mucus method, also referred to as the billing method. Maybe looking at the calendar method, you trying to avoid intercourse on fertile days identified by by tracking cycle length. So you count the days in the menstrual cycle and start with the first day of the period as day 1, right? That will help us estimating the LMP, right? Then you continue counting each day of the cycle until the next cycle starts. Should have day 1 to 7. Of course, day 1 to 7 is generally not considered to be fertile, and one can have unprotected sex, though may have menstrual bleeding on these particular days. Basal body temperature, where you are monitoring body temperature daily to detect ovulation, right? So what should be the basal temperature be? Of course, for most patients, you find that the basal temperature is usually 96 to 98 degrees Fahrenheit, all right? This is typically before ovulation, but after ovulation, it goes up to 97 to 99 degrees Fahrenheit. So there is an increase of 1 degree Fahrenheit for patients who are ovulating. Another awareness method is the cervical mucus method, which is also referred to as the billing method. So here you observe changes in the cervical mucus to identify fertile periods. This billing method is based on close assessment of the cervical mucus. You have to really be careful with it. And generally speaking, over the course of each cycle, cervical mucus normally changes in predictable way, right? Starting from the follicular ovulation to the luteal. If you are looking at it, usually cervical mucus becomes clear and elastic about 6 days before ovulation due to the influence of estrogen. And that makes me also, could I add in some characteristics of fertile cervical mucus? Yes, thank you for that. Maybe we can proceed. The first one, you find that a fertile cervical mucus is normally clear and stretchy, right? A fertile cervical mucus is often compared to raw egg whites. due to its clearer, stretchy, and slippery nature. So when stretched between fingers, it can extend several centimeters without breaking. That means that mucus is fertile. There is typically an increase in the volume of cervical mucus during the fertile period, right? So women may notice more discharge, which is a sign that ovulation is approaching. Fertile mucus is usually more watery and wet, providing a hospitable environment for sperm to swing through the cervix and reach the egg. The mucus is lubricative, which helps the sperm to move easily and survive longer in the reproductive tract. This slipperiness is one of the most noticeable features of a fertile mucus. Fertile mucus has a higher pH, which is more alkaline, and this creates an environment that is favorable for the sperm to survive. This contrasts with the acidic environment, which is normally present at other times in the cycle. The elasticity of a fertile mucus, known as a spiny bucket, allows it to be stretched into several strands without breaking it. This is also a key factor of fertility. Fertile cervical mucus typically has little to no odor. Any accent that may be present is usually mild or not unpleasant. All right. As ovulation approaches, cervical mucus transits from being dry or sticky to creamy and then to fertile egg white consistency. After ovulation, the mucus usually becomes thicker, cloudy, and less abundant, indicating the end of the fertile period. All right, guys. The other method we had mentioned is the withdrawal method, right? Is the withdrawal method. Maybe just to take you back here, I think you had mentioned the methods here. We had said we have natural methods where we have discussed the fertile awareness methods like the calendar, the billing method, right? And now we're going to another option under the natural methods, that is the withdrawal method, right? That is our second natural method. It's also referred to as the coitus interruptus. The male partner will withdraw, right? Will withdraw before ejaculation, and the goal is to prevent the sperm from entering the vagina. It's also referred to as the pulling out method. If you look at typical effectiveness, it's about 78%, right? 78%, right? If compared to the other awareness, the awareness method, this one is a bit more effective, right, than the others. Then you have the third natural method, and here we are talking about breastfeeding, which is, of course, lactational amenorrhea method, the LAM method. And here we are banging on the breastfeeding as a natural contraceptive in the first 6 months postpartum if the mother has not resumed menstruation. So the lactational amenorrhea method is based on the three simultaneous conditions. The baby must be under 6 months. The mother should still be amenorrheic, and she should practice exclusive or quasi-exclusive breastfeeding on demand, day and night, so that to be able to at least embrace this method. So guys, those are some of the types of natural methods, right, where there is no medical or any hormonal involvement, right? They only bang on the awareness of the mom about the cycle, right? Let's look at number two. Number two, we are looking at barrier methods, right? These methods physically or chemically block the sperm from reaching the ovum, and this prevents fertilization. If you look at it in terms of typical effectiveness, it is higher compared to the natural methods. You have an effectiveness of between 79 to 85% with typical use without the spermicides. So we have several examples here. We have the male, female, diaphragm, cervical cap, and the spermicide. Maybe starting with the male condom. Of course, we have this is a sheath worn over the penis to prevent semen from entering the birth canal. So a condom is a thin, loose-fitting pouch or a sheath that normally protects us against STDs or infection. It's normally used as a barrier method of birth control, and these condoms prevent pregnancy by keeping semen from entering the birth canal and fertilizing the egg. I think what you need to be more careful about this method and what you need to teach your patient as an RN is how to properly put on a condom, right? First of all, you have to ensure that the penis becomes fully erect. Then you carefully tear open the condom package. You place the condom on the penis while pinching the tip of the condom to remove air and remove space for and leave space for semen, right? Then you roll the condom all the way down to the penis, then smooth out any air bubbles. If applied effectively, male condoms have effectiveness of about 85 to 87% of preventing unintended pregnancies. Next, we have the female condom. Of course, this is less effective compared to the male, right? It's about 79%, right? Of course, this is a pouch inserted into the birth canal that lines it and prevents sperm from reaching the ovum. It is also referred to as internal condoms, and they do cover the inside of the birth canal, creating a barrier that stops sperm from reaching an ovum. If the sperm can't reach the ovum, then you can't get pregnant. I think that's what we need to know. About the female condom, what we need to be careful is how to remove it. That is after sex. How to remove. You gently twist the outer ring and pull the condom out of the birth canal. Number three, which is another barrier method, is the diaphragm, right? It's a dome-shaped device that is normally inserted into the birth canal to cover the cervix, right? To cover the cervix. And you can be able to see here how we have covered the cervix, right? Uh-huh. It's sometimes used with a spermicide, right? You can use a diaphragm and the spermicide. A vaginal diaphragm is a barrier form of birth control, and I think that's why we have mentioned it under the barrier methods. When used with a spermicide, it can also prevent pregnancy by blocking sperms from reaching the uterus. Diaphragm has an effectiveness of about 87% effectiveness. However, you have to be aware that diaphragm don't protect us against sexually transmitted infections. Cervical cap, right? Cervical cap blocks the sperm from entering the cervix. Cervical cap is a small device than a diaphragm that fits tightly over the cervix, also used with a spermicide. Cervical cap is small and plastic dome that fits tightly over the cervix and stays in place by suction. It acts as a barrier to keep the sperms from entering the cervix, and it should be used with a spermicide. So we have a healthcare professional who must fit it and prescribe it, right? When used successfully, it has effectiveness of between 76 to 88%. Spermicides, also another barrier method. Of course, this one they kill the sperms and often can be used alone or with other barrier methods like condoms and diaphragms. The spermicides contain chemicals to stop sperms from getting into an egg. They come in different formulations. We could have a cream, gel, foam, film, or suppositories. When used effectively, their effectiveness is of about 71%, right? 71%, right? They may be used alone, but are not very effective, right? You can see a 71%. I think it's inferior to the other methods that we have looked at. All right, that takes us to the third groups of methods. Remember, number one, we were looking at natural methods. Then we have looked at barrier methods. And now we are going and proceeding to hormonal methods. These are methods which will alter a woman's hormonal balance to prevent ovulation, thicken cervical mucus, or thin the uterine lining to prevent any fertilization or any implantation from taking place. Of course, we have several examples. We have the oral contraceptive pills, we have the injectable contraceptives, we have the contraceptive patch, we have the vaginal ring, and we have implants. Generally, the mechanism of actions are three. We have number one, preventing ovulation, where we're going to have estrogen and progesterone working together to inhibit the release of FSH and LH. Remember, for FSH and LH to be produced, we have to do what? Naturally, the levels of estrogen have and progesterone have to go down, right? All right. So if we keep them elevated, the estrogen and progesterone, then we not be able to release FSH and LH. We can also thicken the cervical mucus. So you find that we have a hormone that is progestin. Progestin normally thickens cervical mucus and makes it difficult for the sperm to travel through that cervix. Endometrial changes, where these hormones also thin the endometrial lining, reducing the likelihood of implantation if fertilization happens. And those are the major mechanism of action for these hormonal agents. So the first one is oral contraceptives, right? Oral contraceptives. They're also referred to as the birth control pills, are medication which are normally taken by mouth to prevent pregnancy. They are one of the most popular methods of contraception, so it requires daily compliance to maintain its effectiveness, and they do work by inhibiting ovulation. And how do you inhibit ovulation? Because we have elevated levels of the progesterone and estrogen. Also altering the cervical mucus. Remember, progesterone, its work is to make sure that it thicken that cervical mucus so that that will prevent sperm penetration, and also changing the uterine lining to reduce the likelihood of implantation. So we have combined oral contraceptive pills, which are abbreviated as COX, where they contain both estrogen and progesterone. And this method is not recommended within the 3 weeks of postpartum for women who are breastfeeding. And this is due to the risk of blood clots more associated with the estrogen, right? They prevent ovulation by suppressing the release of gonadotrophins, that is the FSH and the LH from the pituitary gland. So you have the estrogen component, which stabilizes the endometrium and reduces the likelihood of irregular bleeding, and progesterone component, which will thicken the secretions, right? Remember, progesterone works on the mucus and alters the uterine lining. Typically, COX are normally taken for 21 days, followed by 7 days of placebo or no pills, during which withdrawal bleeding normally occurs. Some regimens may extend active hormonal pills to 24 or 28 days. So COX, we have different types of COX, my friends, and we use the mnemonics COX M3, where we have monophasic type, triphasic type, biphasic types, right? When used appropriately, COX have an effectiveness of 93%. Let's look at some of the examples of monophasic COX pills, where you find it is referred to as mono because each active pill in the pack contains same dose of estrogen and progesterone, right? And examples we have microgene, Yasmin, Lostrine, Alice, Overall, Ortho, Nodates, and Ovanon. All right, they contain same amount of estrogen and progesterone. That takes us to the second type of COX. That those are biphasic. Biphasic means that the hormone dose changes once during the cycle. So typically, estrogen dose remains constant while progesterone dose increases halfway, right? Halfway. Examples, you have the Marisit and the Nicotine. Taking us to the third one, which are these are triphasic cock pills. And here you find that the hormone dose changes 3 times, right? And 3 times during the cycle with varying periods of estrogen and progesterone containing the pack. So we have examples of like triphasic pills like the Logenin, the Trinodil, the Trisphade, the Trinesca, the Ipneps, and the Trivora. Like you can see the tri in most of them. Then you can have now the extended cycle pills, where these pills are taken continuously for an extended period, usually 12 weeks, followed by a week of placebo pills or low dose hormone pills, resulting into fewer menstrual periods. Examples, we have the amethyst and the seasonic. Low dose pills like the low Lostrin and the Losequin. These pills contain low dosages of estrogen, typically between 20 to 35 micrograms, which reduce the risk of estrogen related side effects. High dose pills, and these pills contain higher dosages of estrogen, typically about 50 micrograms or more, are used in specific cases where low dose are not effective or appropriate. Ogestrel and Zovia are some of the examples. Quadriphasic pills. These pills have 4 different hormone dose levels throughout the cycle. They are designed to mimic the natural menstrual cycle more closely. An example, we have Natasia. Right? Natasia is an oral contraceptive type of birth control used to prevent pregnancy. It's used specifically designed to improve bleeding pattern and is also used to ease heavy periods. It contains 2 medication, estradiol and dienestrol. All right. Okay. So apart from the COX, we also have the POPs. These are progesterone only pills. They can also be referred to as the mini pills, right? The mini pills. They contain progestin without estrogen. So they primarily work by thickening mucus to prevent sperm penetration and also altering the uterine lining. In some women, it also inhibits ovulation. It must be taken at the same time every day for effectiveness with no placebo days, right? So every day, right? Okay. They are often recommended for women who cannot take estrogen, such as those who are breastfeeding or have some healthy conditions. It can be started immediately after delivery, including within 24 hours, and it is safe for breastfeeding mothers. Of course, we have said that generally it works by suppressing ovulation, right? In ovulation, although this one it is less consistent than the combined hormonal methods. Combined hormonal methods are superior in suppressing ovulation as compared to the POPs. Cervical mucus thickening, or where you find progesterone thickens the mucus in the cervix, forming a barrier. Then the hormone also causes the uterine lining to remain thin, making it less suitable for implantation. Right? So we have the POPs, and we can have several differences between the COX and the POPs, right? In doing so, but you have to know that generally the POPs, progesterone only, they are safe for breastfeeding women. They have minimal impact on breast production as compared to the combined oral contraceptives. All right. So POPs do not contain estrogen, which can reduce milk supply, and this makes them a preferred method for breastfeeding mothers. There is also low risk of cardiovascular effects because there is no estrogen in POPs, right? Because POPs do not contain estrogen, they are associated with the low risk of cardiovascular effects such as blood clots, stroke, and myocardial infarction. This makes them safe for women who are at higher risk for those conditions, such as the smokers over 35, or those with hypertension or a history of thromboembolic disorders. We have fewer side effects, like reduced estrogen side effects. Women, who are very sensitive to estrogen related side effects like nausea, headaches, breast tenderness, may find the POPs to be better tolerated. POPs are suitable for women with certain health conditions, right? Option for contraindication to estrogen. POPs are a good choice for women who cannot take estrogen due to medical conditions. There is always immediate return to fertility. So, fertility returns immediately after stopping the POP, usually within the next menstrual cycle, making it easier for women who wish to conceive shortly after discontinuation. We have fewer menstrual issues. They can be used in postpartum period, right? An early contraceptive option. They are also flexible in use and can be used in long term. There's also reduced risk of endometrial cancer when you're using the POPs. Having said that, do COX have any advantage over the POPs? Yeah, COX are very effective, right? When taken correctly, oral contraceptives are over 99% effective in preventing pregnancy, especially in suppressing ovulation as compared to the POPs. COX can also be used to regulate menstrual cycles. They can help regulate menstrual cycle, reduce menstrual cramps, and decrease heavy bleeding. Also, they can be used to reduce the risk of ovarian and endometrial cancer, ovarian cyst, and benign breast diseases. Also, some COX are prescribed to treat acne and hirsutism. This is excessive hair distribution due to their anti-androgenic effects. So those are some of the advantages of COX over POPs, right? But the risk, of course, we have the side effects, which include nausea, breast tenderness, headache, mood changes. Most of these side effects subside after few months of use. Could also have some serious effects like the blood clots. They're also contraindicated in patients with history of thromboembolic disorders, uncontrolled hypertension, and some types of migraine disorders, right? So the COX are generally contraindicated in hypertensive patients, and the reason is that there is increased risk of hypertension. As you know, COX, particularly those containing estrogen, can increase it can lead to and can cause an increase in BP by promoting sodium and water retention, and this enhances the effects of certain hormones that constrict blood vessels. This can worsen existing hypertension. Apart from that one, we have elevated cardiovascular risk, high risk of stroke, and exacerbation of end organ damage. Ladies and gents, now we can look at the injectable contraceptives like Depo-Provera. Of course, we're saying this one has a typical effectiveness of about 94%, right? 94%, where a patient is given 150 milligrams that is contained in one meal, and it should be taken every 3 months, right? Every 3 months, right? So you can start it anytime if reasonably certain if the woman is not pregnant, of course. And it can be started immediately after delivery, including 24 hours, and it's safe for breastfeeding. Depo Provera. What about implants? Like the next Planon? This one, it can be taken. It, of course, if reasonably certain the woman is not pregnant, it can. This one is normally inserted immediately after delivery, including within 24 hours, and it's again safe for breastfeeding. It can be effective for up to 3 to 5 years, and typical effectiveness about 99%. So we have these hormonal implants, right? Hormonal implants, of course, most of them are progestin implants. Of course, most of them they provide long-term contraception without daily action, and they bring about their mechanism or by action by suppressing ovulation. As you know, progesterone is released by by the implant, will suppress the release of LH, and this is going to prevent ovulation. They also thicken cervical mucus. The hormone will thicken cervical mucus, impeding sperm movement and penetration. As other progesterone-only methods, the endometrial lining also remains thin, reducing the likelihood of implantation. The other method is IUCD, which are small T-shaped devices that are normally inserted in the uterus to prevent pregnancy. They are long-term, long-acting, can be hormonal or non-hormonal. For example, the non-hormonal one, we have the copper IUCD. That is the example. We have a Paragard. This is a non-hormonal IUCD that will release copper, and you know copper is toxic to sperm, and this will prevent fertilization. This IUCD, the copper IUCD is normally effective for up to between 10 to 12 years, and typical effectiveness is 99%. Hormonal IUCD, like the Mirena or the Scalar, this one will release progestin to thicken cervical mucus and also to thin the uterine lining, and this will help prevent fertilization and implantation. It is normally effective for about 3 to 7 years and releases hormones locally in the uterus. Typical effectiveness is about 99 years. So we have the copper IUCD and the hormonal IUCD. Mirena is the example that you need to have that one. But generally, the mechanism of action for hormonal IUCD, of course, these are progestin, and majorly, of course, we have cervical mucus thickening. I have endometrial suppression and potential ovulation suppression. We have said and indicated that ovulation suppression is normally effective where there is estrogen, right? Where there is estrogen. Progesterone may not really, but it can also offer some support. So progesterone will also be involved in the thickening of the mucus, all right? So next we have the emergency contraception, and this one is used to prevent pregnancy after unprotected sex or contraceptive failure. This one is not for regular use, right? So we have emergency contraceptive pills containing higher dosages of hormones taken within, of course, 72 hours, like for levogestirone, or 120 hours for like ulipistol acetate out, right, after unprotected sex to prevent ovulation, right? Ovulation, right? We also have copper IUCD. Copper IUCD can also be inserted up to 5 days after unprotected sex to prevent fertilization and implantation, right? But generally, we have the mechanism is all about delaying or inhibiting ovulation, right? Ovulation by delivering higher dosages of hormones shortly after unprotected sex. Emergency pills can prevent or delay ovulation so that there is no egg available for fertilization. There is also potential effects on fertilization or implantation, where emergency contraceptive may also alter the cervical mucus or endometrium, though its primary mechanism is preventing ovulation, right? So emergency contraceptive pills, of course, we have said generally you can use the and emergency ECP pills, or you can also use the IUCD, the copper IUCD as an emergency, right? As an emergency method. Then now we have the permanent methods, and these are methods that provide a permanent solution to prevent pregnancy. They are suitable for individuals or couples who are sure that they do not want any children anymore. So here we need careful consideration, because if it's not done, then these methods could lead to regret. So like for the females, we have the tubal ligation, that is female sterilization, and for the males sterilization, we have vasectomy. So female ligation is of course a surgical procedure where the fallopian tubes are cut, tied, and sealed to prevent eggs from reaching the uterus, while the Sterilization, male sterilization is a surgical procedure where the vas deferens, that is the sperm ducts, are cut or sealed to prevent the sperm from mixing with the semen during ejaculation. So we could have, like you can have on my left, we have the tubal ligation, where we have cauterization, tying and cutting, or just banding or clipping, right? Clipping together. You can notice that the banding or the clipping can be reversed, right? Yes, can be able to see that. All right, and then now we have the male sterilization procedure that cuts and seals the vas difference. You cut, you tie and cut. Its effectiveness in both cases is 99%. All right, guys. Now we go to dual protection. Of course, these are the kind of methods that we are trying to preach and make the population to be aware of, because this involves combining methods, and this will help prevent not only pregnancy but also STIs. So we prevent pregnancy and STIs, and it typically involves using a barrier method like condoms alongside another method. Like best combination methods that we have, we could use an condom and an oral contraceptive, which is going to provide protection against pregnancy and STIs. You could also have use condoms and IUCD, where you are protecting STIs while IUCD prevents the pregnancy. Generally, we have these methods that can be started within 24 hours, like the POPs, the injectable contraceptive, the implants, copper IUCD, of course, inserted within 10 minutes after placental delivery. You could also do hormonal IUCD if it's started with 10 minutes after placental delivery, male and female condoms, and female sterilization. Ladies and gentlemen, that's all about the presentation on family planning methods. Remember to get into the description section to practice on the different methods of family planning methods. Until next time, guys, take care of yourself. See you.